All right, it's 5:30. I'd like to start the meeting by acknowledging that this meeting is respectfully held on the traditional territory of the Psychiatric First Nation, on whose land we live, work, and play. I'll call the hearing to order. I have a statement to read here. This public hearing is being held for the purpose of hearing and recording comments from members of the public regarding a request to amend the official community plan and zoning bylaws for 296 2nd Street West. Notification of the public hearing was completed pursuant to the Local Government Act and Public Notice Bylaw 1252/2023. Letters to surrounding property owners within 100 meters of the subject property were sent January 15th, 2025. The role of council is to hear from those who wish to provide comments regarding the proposed application. Everyone who wishes to speak will be given the opportunity to be heard. No one will be or should feel discouraged or prevented from making their own views known. Please keep comments to matters related to the OCP and zoning amendment application for the property only. Members of council may, if they wish, ask questions of speakers following their comments. However, the main function of council is to listen to the views of the public. It is not council's role at this public hearing to debate the application. Submissions regarding this application may be received prior to or at this hearing. No further comments can be received or considered by council after the public hearing is terminated. Please clearly state your name before you begin your comments. Okay, so item number 4 is just background documentation on the zoning amendment request. So we go straight to 5. 5.1, public submissions in writing. I don't believe we've received any, which we have not. 5.2 would be public submissions from the gallery. Does anybody have a submission? Yeah, so anybody that has a submission, feel free to get up and speak at the podium. See you later. Okay. Okay. Asking a second time, any public submissions from the gallery? Asking for a third time, any public submissions from the gallery? With that, I'll close the public hearing. Okay, so we'll call the regular meeting to order. We'd like to start by acknowledging that this meeting is respectfully held on the traditional territory of the Psychiatric First Nation, on whose land we live, work, and play. You have an agenda circulated. Did we have any additions?
Can we add the public hearing to get first and second, third readings?
You can add third reading.
Third reading, thank you.
Do we have a seconder for that amendment? Any further amendments? Oh, and we'll just note here, Work BC isn't attending tonight, so that'll be taken off the agenda. Okay, would somebody like to move we adopt the agenda as amended? Oh, I guess we should vote on the amendment first, should we? How does?
No, as amended.
Okay, okay. Move it as amended. Seconder, all in favor? Carried. Okay, we have the minutes from the January 13th and January 20th meetings for adoption. Would somebody like to make a motion? Seconder? Second. Any business arising from them? All in favor? And that's carried. Bylaws following of public, where does the
Right there.
right there? Okay. So that would bring the third reading of the bylaw that is in your previous agenda.
Yeah.
For third reading. Go ahead. What are you on here?
Have you put my name on?
Blank. No, I don't have control over it.
So the recommendation would be that the bylaw be read a third time and forwarded to MOTT for approval prior to adoption.
I'll make a motion to move for First, second, third?
Just third.
Just third, and send to MOTT.
Any further discussion? All in favor? That was carried. Okay, with that, we move on to delegations. 5.1, Dr. Barbara Kane. Come on up. Right there, yeah.
Okay, great. Yeah, thanks very much. Not exactly sure if I was invited, but someone suggested that I come to talk to you. And yes, I think it was you. Yeah, oh, right. Okay. I gave a talk at the NGLC or something like that. NCLGA, yeah. And that's what led to this. So the talk at the NCLGA was a lot longer, but I'm going to give you a little summary. So I'm a psychiatrist at the at UHMBC. I've been here since 1990, and I'm here today to talk to you about why so many of us think that Northern BC needs a psychiatric hospital. So in 2018, I got a job, a sort of administrative job with Northern Health. And so, which allowed me to, look at different things in the mental health area. And I decided one of the things I wanted to look at was what sort of community resources we needed. Because we had patients who were staying on the psychiatric ward for years sometimes, and we still do. So at that time in 2018, there was one person who'd been on the ward for 5 years and one who'd been on the ward for 3 years, which is not what we're really built for. And we tried to get them out of the hospital, but most of the time they came back because of violence. It was violence in whatever resource they went into. So I wanted to know how many people like that there were across the north to get a sense of the scale of what we might need to develop. And in doing that, I found out that there were more long stay psychiatric patients than I knew about. And because of their long stays, they were having a significant impact on overall hospital functioning, not just our ward. And that was a bit of an eye-opener for me. Because the people who stay on our ward are usually the most severe ones. But because they're there, other people who should be able to get onto our ward can't get onto the ward. So they either stay in the emergency department a long time, for days waiting for a bed, which is not very conducive to mental health, or they go to other wards. They go to surgery or medicine, even pediatrics or maternity sometimes if we're really over capacity. And for example, if you have 52 psychiatric patients who each stay for a week on the surgery ward because they can't get to our ward, that means there's one less bed available for surgery for a whole year. And they say the average length of stay for surgery is about 3 days. So that means ballpark, there's 100 surgeries aren't getting done every year when we've got patients on their ward. And if there's 10 beds occupied by psychiatric patients, usually there aren't that many, but there can easily be with the regular long-term care patients being on on surgery wards. So you can end up with thousands of surgeries not getting done in a year. And you can't tell a suicidal patient or a patient who was violent and psychotic and brought in by the police, you can't tell them to come back next week when we have a bed available. That doesn't happen. But you can cancel elective surgery. So elective surgery is kind of the canary in the coal mine. And that's been something that's really been affected, not only by long stay psychiatric patients, I'd say way more by long-term care patients who are in the hospital. But psychiatric patients are playing a role in that as well. So why are they staying so long on our ward? And one of the main reasons is that the only psychiatric hospital in BC, Riverview Hospital, closed in 2012. And I'm not sure why it closed. and why people thought we could do without it. But some of it was probably financial. And I think some of it was the idea that people could be treated and managed in the community if we had enough resources. And definitely some people can. But there's a subset of patients who cannot be managed in the community, at least not without a lengthy stay at somewhere like a psychiatric hospital first. And lengthy stays in psychiatry are usually in the range of years, actually. And then there's another subset who will never get better. Not everybody gets better, that's for sure. So there's people who will always be a risk to themselves or others. And a case in point is the person who did the Chinatown stabbing. And I only know of him from what I read in the newspaper, but he was from Kitimat. He murdered his daughter. He was found not criminally responsible by reason of mental disorder, which is the Canadian version of not guilty by reason of insanity. And he's been in the forensic psychiatric hospital now for probably about 15 years, because I think that's about how long ago it happened. And the forensic psychiatric hospital, which is in Port Coquitlam, and it's across the river or the highway, I think, from where Riverview was. It's a psychiatric hospital, but I can't get anybody in there because the only way to get in there is to commit a crime. So, but when Riverview was open, I could get people into Riverview, and so could most other doctors if they needed to. So the person who did the Chinatown stabbing had been out on passes before, but he was given that day pass that time and went out and did the stabbing. So he'd been in that psychiatric hospital for at least 10 years. He almost certainly had every treatment that could be given. So, and he still wasn't well. And some people just never get better. They're not all violent, and some are more of a danger to themselves than to others, or they can't look after themselves. And these people need lifelong treatment or care, and some of them on locked wards. So when Riverview was available to us, the most severely ill or the violent ones would come to our ward, but in that sort of 1990 to 2005 range, because I was there for all of that, they wouldn't stay on our ward, not even a week. They'd get transferred to Riverview. So we can handle violent people, especially on the short term, but the long term is another story. And now we don't have anywhere to send them. And that means we're taking people with a level of violence that we weren't built for. As well, in the past, when some of the patients finished their time, if they went into the forensic psychiatric hospital, if they were sort of finished with what needed to be done there, but not ready to go out into the community, the forensic hospital would send them to Riverview. So Riverview is kind of an offload for the forensic hospital. Well, the forensic hospital doesn't have an offload anymore. So they try to send them to us when they're done, which we usually refuse them. And it's not a very good situation. And the other thing is, with the forensic hospital basically in gridlock right now. It's very hard to get anybody, even the court, to get anybody in there. The other way people get into the forensic system is through jail. So if you commit a crime, you go to jail, and then you develop a mental illness. So it had nothing to do with your crime. You develop a mental illness in jail. They were all supposed to go to the forensic psychiatric hospital. So people would go from PGRCC if they became psychotic or developed schizophrenia. They'd go down, they wouldn't come to us, they'd go to the forensic hospital. Well, they can't get into the forensic hospital anymore. So one of two things happen. Either they get committed and they get sent to our hospital. So again, we're dealing with a more violent level of patient than we did before. Or if they can't get in, if they don't get committed, they can't be treated in jail against their will. So if they'll agree to treatment, it's fine. But if they won't agree to treatment, if they're too severe, the jail sends them to us. Otherwise, the jail just hangs on to them untreated. and they get released at the end of their sentence. So they're in terrible shape when they get released. So it's not very good for public safety either. So we're getting more and more people from the forensic psychiatry system into our hospital. And we only have one 20-bed ward. We have 4, in addition, 4 locked beds. But all the patients mix on the same ward. So you've got people who are in for depression, people from 19 to 90, and they definitely tell our staff that they don't feel safe when some of the patients are on the ward. So they don't necessarily even know that they're forensic patients. They just don't like the way they act. And the other thing is, it means we're discharging people who are still dangerous and really who shouldn't be discharged, but we can't keep them forever. So it's a lot of moral distress for the staff when you have to discharge people that you know are dangerous. And that's part of the reason I'm doing this, because I've let people go that I really feel like I shouldn't have let them go. So I don't know. Yeah, I guess I know you've got, yeah, I think I can do this. It won't take me too long. There was a report done by the Vancouver Police Department in 2008 called Lost in Transition. And in 2007, they noticed a marked increase in incidents involving people who are mentally ill. So minor property offenses, aggressive panhandlers, suicides, tragic incidents. So that was before Riverview closed. But Riverview didn't just close in 2012. They gradually sent people out. And I've talked to some people who worked at Riverview then, and they said, one guy who worked there from 2002 to 2005 said he recalled a fellow who was in there for a long time. They found him somewhere else in the Lower Mainland to live. And so off he went. And a week later, the police brought him back because he wasn't doing well. And they said, well, he doesn't have a bed here anymore. So he had to go to Royal Columbia. So this is even before 2005, there was an impact on the general hospitals and probably on the streets. And that's, I think, why the police department was noticing all this stuff even before Riverview closed. They recommended that a mental health care facility that could accommodate moderate to longer term stays for chronically mentally ill individuals. That was one of the reports suggestions. Again, this was 4 years before Riverview closed. It was also before really the drug use that we have now. And so, they were noticing trouble even before the drugs got as bad as they are. So I don't think we can blame everything on the drugs. I think as well, once you got all those people on the street, that makes the drug, but I mean, we can't blame all of that on closing Riverview, but it sure didn't help. And then there was nowhere to put the people who were using the drugs. So I said that when I started doing this, I wanted to see what community resources could be developed for these people. But I've learned over the past 5 or 6 years that that severe subset of people cannot be managed in community resources. We've tried to end up back in the hospital. And community resources will not take, and they should not have to take people with ongoing violence. So for example, psychiatric hospitals have trained response teams. They can deal with violence and psychosis 24/7. They don't call the police. They don't have to even call security. They've got their own teams. So because if you put them in a community resource, which we do to some extent now, and they get violent, police get called, they take them to the hospital, and then the resources won't take them back, understandably. You have to have a place big enough. So I know that on the island recently, they were talking about developing, not a psychiatric hospital, but sort of small 20-bed units around the island. And And I argued that that was not a good idea because then you don't have enough staff 24/7 to deal with those people. But I think the idea is people are trying to be nice to the people with mental illness. You know, well, for one thing, I think to some extent, people don't realize how, severe it is and what kind of stuff we have to deal with. And they don't, and there were, abuses in the past, but realistically now, I think it's wishful thinking to think that small resources are gonna be able to deal with this. So that's kind of what led to this petition asking for a psychiatric hospital. So there's a petition. I actually have one if somebody, I don't know, maybe you passed them around before. So, but you can go on to change.org. And if you punch in Northern BC Psychiatric Hospital, you can sign it if you want to. I will say that there's been over the last, 4 or 5 months that this has been going on, because it's not just me that's doing it. There's other people. I'm just the spokesperson. But it's looking like we're going to get something. That's my sense. So I think that if we do, the thing that we're talking about is the Prince George Youth Containment Center, which has 48 beds. It's got 4 12-bed units. All the rooms lock, all the units lock. And then there's a 13-bed house also on the property, and it's all behind a fence. So that's what we're looking at. It basically has everything that we need, and we by far the cheapest and the fastest thing to do, as opposed to having to build something. So we're hopeful that that's what's going to happen. And yeah, I think that's most of it. So I don't know if people have any questions or.
You bets. So I just have to refresh this so I can get the mics on. Hey, Councillor Ballmer.
Thank you very much, Dr. Kane, for that presentation. And it's something that is weighing hard on everyone ever since the closure of Riverview. And I just listened to a debate on the way down here about reopening Riverview, and it looks like they've admitted that it was a mistake to shut that down, and it looks like they're actually going to look at some kind of facility like that. The one you're looking at for here, how large of an area would that one serve, do you think?
Oh, our idea.
The whole north. Right.
They both. You would look at. Yeah, I think probably it's not going to be big enough.
I was gonna. Yeah. So if all the wheels are turning exactly the way you want them, what kind of timeline would you think we're looking at?
I don't know, maybe optimistic. There, it's got. I don't think it's going to need. I don't think. You need all that. It's a lot of room. All that. So I think it's nice. I've been in there. I worked there. I go up. It's got a gym. It's got a medical area. It's got a lot of offices and.
Mm-hmm. Well, thank you. Thank you very much.
Councillor Frankel.
Dr. Kane, thank you. It's something that as small local governments and even larger cities, like you're from Prince George, tough to try and deal with. It's very difficult. And we all have friends, we all know people that suffer and can't get in for various reasons. I'm glad you alluded to some of those reasons. I just wanted to let you know that, as local governments, it's good to get feedback like this because we do meet with ministers all of the time. So now we can even advocate, but I do want to reassure you as local governments, the Union of British Columbia Municipalities, which represents all 190 local governments, has 3 resolutions that have been endorsed by all of us in front of the provincial government, looking for Riverview to be reopened. So I just want to let you know, and I'll get your contact information from Councillor Lozay, and then I'll send you those resolutions. So you just see the help that's behind the scenes as well.
You know, when we started doing. Government, we are able to get there. I suspect that's gonna. Just as bad as we do. So some of the patients up from Vancouver.
Mhm. Anybody else? Councillor Young.
Just, you mentioned, so it'd be 19 and up. That's the,
Yeah, that's the moment.
Okay. Mhm.
You know, I'm gonna put it on the table. I'll get into a room and talk about exactly what are we gonna do with it if we get it. And I think we need to look at those numbers. Hearing that there might be a need for. Like this is.
Mhm. Yeah, we've run across that. I work at the high school across the street here, and over the years, we've ran into many situations where, I shouldn't say many, but every year we go through some things and not just in our community, but elsewhere in the school district. And there is a lack of beds there for our youth, and they've had to wait. They've had to go back to hospital. As you've already alluded to, our hospitals aren't built for that in small communities to take that on. So it's been a real heartache for the parents and for others who are working with those young people. So what I was getting at is if it's 19 and up, does that then create a little bit more space at the other end again? Because, well, no, yeah, because I can see it'd be a significant issue trying to place them in the same facility that you're building, but there's going to be maybe some more space than to accommodate that in the meantime, because there definitely is none now. It's really, really tight, so. Okay. Yeah, that'd be excellent. Yeah.
Mhm.
Well, if you get all the right people in the right room and have those conversations, hopefully, so.
Thank you.
Yeah, because definitely the opportunity to get help sooner instead of losing years of their life frustrated with that. So it'd be awesome. So thanks.
Councillor Lozay?
So, Dr. King, I just want to thank you for coming in. And if, there's a choice to support you, it could be signing your petition, I guess, would be the first step. And then, yeah. Okay. Yeah, no, again, thank you very much. It's nice to see some kind of solution proposed. Yeah.
I was just wondering, I missed how many total beds at the facility you're looking at? Yeah. And again, what would you estimate the total need of beds in the north to be? Yeah.
Exactly what.
Yeah.
Probably would, but I mean, I think get this, how this goes, it'll make a pretty big difference. Also create an us parents, we're all gonna take people out of their ward. Here, other people getting in, so I think we're gonna have a better turnover on our. Be easier. Other people to get in, so they're not merged all the time. I think that's.
Yeah.
Help,
That's great. And I think, as Councillor Franco said, I mean, advocacy is one thing that we can offer. And if we keep in touch and make sure we know where that movement's at and what we can do to be useful, I think that would be great. Thank you very much. That was a great presentation. Okay, moving on to 6.1, Economic Development Strategy. You have a recommendation there? Oh, sorry, I didn't see you on there.
Well, there is a recommendation and this was this initiative is funded through the Rural Economic Education Infrastructure Program. And it is prompted by the downturn of the forest economy. And so, you know, how do we vision this is about trying to determine how we vision the way forward. So it's involves a consultant, MNP, and it's will involve as many members of the community and members of council that want to participate in this. It's a 1-year project, $118,000. Again, it's paid for out of grant funding, but at this point in time, the consultant has actually started with. We went through a competitive bid process. We had 5 applicants. We screened all of them, including face-to-face interviews with them. And we really recommend MNP as they were the pick of the litter for sure. They've started with their data collection at this point in time. So we're asking for council to award of that contract to MNP.
I'll make that motion.
Second. Any further discussion? All in favor? Carried. Good. Okay, 6.2, NDIT grant application for the pump track.
This is simply a funding opportunity. Aside from the pump track project is with contingency about 1.2 million. We have $500,000 from Hanfor donated. So we've got a significant chunk that's remainder. NDIT, their funding stream has the potential of offering $300,000 towards that. So we're recommending an application to NDIT into the recreation and infrastructure funding stream.
Seconder. Any discussion? I'll just say it's great to see it come in for the first intake. That really is key to being successful at NDIT. All in favor? Carried. Okay, 6.3, Provincial Water Metering Pilot Program.
Oh, you're up.
So we've been approached to put in an application for a water metering pilot program. So the provincial government, through the Ministry of Housing and Municipal Affairs, has a grant that will pay for 100% of the installation of water meters in residential, commercial, and in, institutional industrial facilities. So this would make it so that our entire system is fully water metered. There is costs that won't be included in this, so that would be making sure that there's water metering at our source locations, which we have in place already. And then also, other than Northside Water, which we'll have to get onto a registering system so that we can make sure that that's collected as well. The 100% coverage is for the installation into the properties as well. So we can actually pay for a contractor to do that work and include that as part of the costs. So the application will go in that format. We're looking for support from council in order to move forward with this.
I'll make that motion.
Sounds good. Discussion? Councillor Vandola.
So previous to me returning back to Vanderhoof, we lived in Dawson Creek and Goose Coopy, and they had metered water at each of the residential location. I don't have a problem with them having metered so you can identify the individual residences or industrial areas that are consuming water. But what we found while we were living there was additional kind of a tax grab, because we're only allocated a certain amount of water a month. And if you went over that, it was $10 or $20 for every 500 gallons of water you went over top of that. And so that piece kind of worries me a little bit, because if we're having the meters is one thing, but then if we're going to use it to actually charge people water use above and beyond what we're already charging, that concerns me.
Yeah, so I've lived in communities before that have fully metered. Usually your base rate is quite low, and then you're charged based on every volumetric meter of water that you use. It does help to reduce the amount of water consumption. But at this point, we're not looking at the cost aspect of it. We're just looking at the collection of the data. The other thing that is included as part of this package is that every one of the sites will have its own cellular connection. So it will be able to give you information like leak detection. So if a leak detection is initiated from that site and you've signed in as you're wanting to collect that information yourself, you'll be notified and be told that there is a leak within your property and you need to find a way in order to resolve it. If it's not resolved, then there may be ways through bylaws or other measures that we may encourage them to make those changes and modifications. The whole idea is to reduce the water consumption. As I mentioned, we're not looking at the metering aspect at this point as far as billing, but that's something that could come in the future. Typically in locations where meters are installed, people that are used to using a certain amount of water, once they start going onto a metered system, reduce the amount of water because they realize how much they're using, or the billing kind of encourages them to go in that direction. One of the biggest areas, of course, that water is used wastefully is with irrigation outside of your property. So trying to find some ways in order to minimize that as much as we can.
I've also been in a community where we did this as a pilot program. So what happened was residents would get their utility billing and it would be their normal billing, but underneath it would show what their billing would have been should they be on a metered system with their consumption. And that way it was more targeted at those people that are high consumption users to educate them as to how they can reduce the amount of water they use, because this way it'll tell us who the big users are and they can see for themselves on their billing. They're not necessarily billed, but they can see that.
Thanks. I'm looking forward to seeing the data. I think our water use bylaw that we have is very restrictive in what we can probably charge. We have commercial users that pay very, very little and sell our asset and make money off of it. So it'd be interesting to find that out. I think we're all going to be decent when we look at our homes, but that's the data I'm looking for, is that, so.
Any further comments? Okay, all in favor? Carried. Okay, 6.4, official community plan and zoning amendment bylaws for 1133, 1145, and 1157 Industrial Drive.
Yeah, I wasn't involved in this one.
So this application is to amend the OCP and zoning bylaw. The owners have amalgamated the 3 lots right beside the hardware store. And they want to move their home-based business, Northern Monument, to that lot on Industrial Drive. So they want to rezone it to industrial. And if council gives the 2 readings, it'll go forward to a public hearing.
Brief the recommendation. Second. Any comments? All in favor? That's carried. Okay, 6.5, zoning amendment application for 2824 Burrard Avenue.
That one was me.
Yeah. There you go, you're on now.
This is a site-specific text amendment to increase permitted density from 75 units per gross hectare to 91 units for a senior rental housing.
So do you want to move the recommendation?
I'll move the recommendation.
Second. Any discussion? All in favor? That's carried. Okay. Councillor items. Why don't we start with Councillor Martins this time and go that way around the room?
Yeah, thanks. I don't really have
Okay. Councillor Bulmer.
Went to the only thing I did since our last meeting was go to the Chamber of Commerce meeting, and it was sparsely attended. Everybody had the flu. So we didn't get a whole bunch done. There's some in-camera stuff. We'll talk about that later.
Okay, Councillor Vandola.
Oh, yeah, thanks. During the week of January 15th to 17th there, myself, Councillor Frankel and Mayor Moutre attended the Natural Resources Forum in Prince George. Extremely well-attended event, lots of different MLAs, MPs were in attendance. The event started off with both Bob Zimmer and Todd Doherty kind of denouncing the current federal government's policies and doing a kind of certainly they're kind of pushing the progressive conservative agenda to get going on that. The second kind of group was who had Rio Tinto did a bit of a presentation on the importance of connecting with the University of Northern BC and developing some science and also developing professionals locally that could help with their industry. They had a forestry panel of setting up there, and really one of the messages is that we need to really work on removing the outside anti-forestry interest groups messaging on all the different social platforms. Certainly there's the day that we were attending, there was a kind of a blockade from interest groups kind of making it difficult for people to enter the facility. So that was interesting. And of course, still the same talk that need challenges of accessing fiber, And in some cases, they announced the federal provincial policies have hindered the ability to access fiber. And of course, the big message, as we've all heard, is that really need to develop those valuable First Nation partnerships to get them involved in the forest sector. And then we also heard from First Nation reps that, they want to get involved, but they just need to know what the rules are, and they're really interested in that. We also had chances to meet with RTA and Artemis. Artemis announced that they had their first pour here this week, so fairly exciting that we're actually producing gold out at the site. And myself and Mayor Moutre met with the FPX nickel group that's planning on doing a nickel mine north of Fort St. James. We had the ability to meet up with the new Minister of Mines, and he announced to us that they are going to be putting forward funding to develop more mining education that'll be coming out of the post-secondary education ministry. So we're looking forward to seeing what that looks like going forward. So, and that's kind of it for me.
Perfect. Councillor Young.
Also had a chance to attend a meeting at the resource forum there, as well as hear back with the minister here in our community. The Chaco Valley Historical Society, we met with them last week. They're meeting again tomorrow, planning some activities for next year for the 100th anniversary. So just everybody in attendance maybe think about that, as we're now less than a year away from when Vanderhoof became a community, not a community, but an incorporated community. So that's pretty exciting. And yeah, there are a few other things, but I'll leave it at that.
Great. Absolutely.
I'm going to go way back to November 26th because we didn't have a regular meeting, or this didn't happen. So I just wanted to, I attended a CNC nursing PAC meeting, so I just wanted to provide an update on that. So they did quite a bit of talking about their healthcare access program and their students, and they noted that students in this program have really relieved a lot of stress on the long-term care facilities in addressing staffing shortages and providing a steady flow of trained professionals. So I think it goes back to showing that when they're trained locally, they stay local. So they also noted that the high flex delivery model is not really working the way that they anticipated it would. So they want to really focus on making some improvements with that model of delivery so they can optimize learning outcomes. They're also looking at different strategies to recruit students to CNC's nursing programs, including outreach as early as grade 8 and 9. And also exploring dual credit to guide students towards these programs. So I just wanted to give you an update on that because I didn't. So on January 21st, I attended a library board meeting, and they're quite excited because they're collaborating with Connexus and Psychas to add some new monthly programs. And they've noted that the teen problems that they had in the library have really settled down. However, they would still like to connect with the school district and other organizations working with youth to talk about strategies and processes to address disruptive behavior if it starts to come up again. So they believe it's a community problem, not just a library problem. And then I also had an interesting conversation with somebody who lives on the corner of Hamilton and Vanderview a couple weeks ago. And this person noted that there is a two-way stop there, but there is not a four-way stop. And she said several times she notices people going through the two-way stop sign. And yeah, I found that out the hard way. And, I know I have seen people going through that stop sign. And so I'm just thankful nobody's been hurt really, really, really bad. don't know, whatever that's supposed to sound like. But I'm just wondering if it would not be a good idea to maybe look at that area and see whether or not a four-way stop, because I do notice there are blind spots when you approach it coming from from Loop Road or north side down Hamilton. And so I would just like to bring that forward.
Sounds good. Councillor Franco.
Yeah, I will attest to there's currently blind spots there with snow piles. It's not, it's ours, it's the user of, the facility, but anyway, I won't spend much time on resources forum. I think meeting the premier and others was fantastic. I think handing them all a map of the Vanderhoof, Fort St. James and Lakes District with the fire maps on it was phenomenal. That was very wise of us to do because they all went away with the little polygon of Stanley Park in the middle of some of those fires, understanding the gravity of the situation that we face in our area. So, and it's topic of conversation. And so I think that was good. Attended, this is the 4th local leaders for mental health. We're an ad hoc organization. We talk about local leaders that need some help. And it's more than the attacks are brutal. They're getting worse. Everyone says, oh, suck it up. You know what you got into? No, we didn't sign up for any of this. I think peaceful conversation and a good debate is positive, but the attacks are brutal, and this is across the province. And it's not a good thing. And so we're moving that forward. In fact, the resolution that Islands Trust did will go to all area associations for debate in April and May, and then go to UBCM for endorsement. So Councillor Van Dola and myself and Mayor Moutre met with Jobs and Economic Development. I thought it was a pretty good meeting. And I think everyone's in our camp to try and help things out there. We can't go over some of the project details, but I think that's a good thing. Lots of BC Timber review stuff, which has been a handful, but we're at the forefront of some of this in our discussions. Vanderhoof needs this, Vanderhoof needs that. And this is coming from a provincial group. So I'm really happy that we got looked at, and it's leaning on people that we know, Dave, and giving us the ideas, more ideas, because everything's on the table. Lastly, today I attended the Chaco Valley Food Network presentation just to hear what they were up to. I was invited because we've been talking about our greenhouse project through the Environment Committee. And there are several that are going on. Psychiatric is looking at one. Darren Carpenter leaned over and says they're looking at one at Fraser Lake School for potatoes and all of this stuff. So I think it's almost a time that we maybe get all the groups together and have a conversation about who's who in the zoo and what's everyone trying to do. But the interesting part is we're trying to grow our own food. And I think that's a real positive thing. So however we get this off the table, I think it'll be great. So that's what I have. Thanks.
Thank you. Mostly, I won't talk too much on the resource forum, but I do think it was time well spent there. I think it was really good networking. Just having the amount of ministers, the amount of companies that you can actually go and talk to so close was great. I've heard some people complain a little bit about the venue, but if you move it away from Prince George, we lose that access, right? So it needs to stay there. Absolutely. Great to see having 3 ministers right here in chambers in Vanderhoof is huge. We haven't had that in the past, right? Need to keep our foot on the gas and make sure that we're following up on those and encouraging more to come and visit us, because there's nothing like being on the ground. I totally agree. The map was a huge hit, if you will, and it was great to see the premier especially engage with it so much and have a lot of questions and go through it. So that was a huge piece. Yeah, I'll leave it there. I think everything else has been pretty much covered. It's been a busy few weeks since our last meeting, and everybody's been really busy, and it's great to get that work done and to get that level of attention. We don't need to see that. Okay, release from confidential 8.2. That's just for information. Correspondence can be found there. Does anybody have anything they want to take out of that? No? Then I declare us adjourned. Thank you all.